So protein is important. It turns out we don't need enough protein. And protein is an essential building block, so we need to eat more protein. I think the punchline of the whole story is the fats. Again, traditionally, based on the food pyramid and based on what Ansel's Key said, fat was bad. But when you look at the science of insulin resistance, it tells you that fat is not the inflammatory fuel. It doesn't trigger insulin. Okay? Fat and cholesterol in our diet is essential because our body, our cells of our body, our brain are made up of fat and cholesterol. It's part of normal function. We're looking for nutrient-dense foods to fill people up, and fats are nutrient-dense, and that's good. We all agree that there are healthy monounsaturated fats from olive oil, nuts, and avocado. But what I'd like to suggest to you is that there's really not a problem with fats. Of course, we've heard about trans fats or hydrogenated fats, and we all agree that they're unhealthy. But things like coconut oil, which is actually a saturated fat, it has a certain type of fat, medium-chain fatty acid, which people are looking at and are understanding that there may be some health benefits to it. The problem is the combination of foods. If we eat fats with carbohydrates, we're going to have a heart attack. And that's the way that we're eating nowadays. And I use this by example. I tell my patients that they can eat eggs in the morning, they can have a cheese omelet. The problem is what we typically combine that food with, and it's with carbohydrates. And imagine what you eat with your eggs. Cereal, toast, mashed brown potatoes, pancakes, maple syrup, orange juice. So when you combine those foods, specifically carbs and fat, that's going to turn on that insulin switch that we talked about, because the glycemic index of the food has risen, and I'm going to talk about glycemic index. And that message, again, is to store. So we store the foods and we drop dead of a heart attack. And so that's the problem. So what we want patients to do is to reduce carbohydrates in the diet. Most protein foods that we eat in our diet have fats around here. And so by default, you're going to eat more fat and cholesterol. But when you understand insulin resistance, it's a good thing to eat fat. Okay, so there's medication. I'm not going to talk much about it, but again, these are smart drugs that are hormonal drugs to treat insulin resistance, help people lose weight. We treat their existing medical problems in our office, and I fail if a patient goes and gets bariatric surgery. We want to really help these people lose weight before they have to have a surgery to help them lose weight. So here's the tools that we share with our patients. And the one tool is the glycemic index. What is that? That's a measurement of the food's ability to rapidly raise blood sugar, and it's not on the food label. But look at the foods that have a high glycemic index. All the corn, grain, and wheat products. So pizza, macaroni and cheese, ramen noodles, processed refined carbohydrate, and of course sugar. Some would argue that sugar isn't much different than corn syrup, is the next tobacco. And people say that, well, sugar's healthy, it's in fruit. Well, guess what? Tobacco is a naturally occurring substance too, but we know that that's not that healthy for us. And the same is true with sugar and fructose. If you eat too much, it's not healthy. Let's wait till the end, okay? I'm sorry. So we have other tools where it can actually count the grams of carbohydrate. And the more you restrict carbohydrate, the more weight you'll lose. Now, every person is different. And when you guys are younger, you can actually handle more carbohydrates than adults. But as you get older, as you go through puberty, you're going to not be able to handle carbohydrates as much as you can currently. So what else is important is that we tell patients the quantity and calories are really less important. What we're trying to do is regulate insulin. And the way to do it is by eating the right foods and not starving ourselves. So let's compare diets. And the way we can compare diets is we look at the macronutrients that we consume. And so those are the carbs, protein, and fat. So we have very low-fat diets to very high-fat diets. And so very low-fat diets are more along the lines of the traditional Weight Watchers types of diets. And in those diets, what's important is that they are trying to restrict calories. And in the very high-fat diets, we're trying to regulate insulin. Now, some of the traditional low-fat diets do work, and it's probably working for the wrong reason. And the reason is that they're restricting calories, and people are probably eating less carbohydrates on these low-fat diets than they were when they started. But again, the point is that it brings us back to carbohydrates, helping people lose weight. And so the diets that are healthy or safe are the ones that I look at in my office, and what happens to markers of inflammation. We support patients that are able to lose weight, but we want to look at the markers of inflammation. And the studies that I'm going to show you over the last 10 years, I'm not going to show you, I'm just going to zip by them actually, but low-carb diets improve health. And on this slide, basically there's 4 diets, and this diet on the bottom here, this shows weight loss on the left. I know you guys have been looking at studying graphs, and this is time that you go out over 12 months. This diet on the bottom, which happens to be the Atkins diet, which is an extreme low-carb restricted diet, they sustain the greatest weight loss over 12 months. Now we need to do more studies because 12 months is really a short time. And this slide and the next slide just demonstrate that the markers of inflammation are improving on these carbohydrate-restricted diets. And we're not telling you guys to restrict carbs. We're just telling you to think about the carbohydrates that you're consuming and try to eat healthier carbohydrates. But my patients, we're trying to help lose weight, so that's why we try to focus on these things. So we're actually almost finished. I was just going to present some patients. So this is my patient David, who lives in Boulder. He looks kind of like Santa Claus to me. But he was basically type 2 diabetic when we met. And what we did with him was we taught him how to eat differently. He knew a little bit about it for himself. He's very knowledgeable, but he spent 12 years being a diabetic and overweight. So we taught him how to restrict carbs. We changed around some of his diabetic medications and taught him and switched to medicines that help with weight loss. And 2 years goes by, and these are just some of the blood parameters before and after his cholesterol. Everything got better. And he loses 159 pounds, which is almost half of his body weight. And now he has no signs of diabetes. His cholesterol is perfect. I can't even tell that he was a diabetic. So, and that's an extreme example. He's kept his weight off now for 4 years. And then I just have one more patient. This is Patrick. And he wasn't diabetic, but he had some issues with cholesterol, and he was insulin resistant. And we again taught him how to eat better, how to cut the carbohydrates out of his diet. He goes ahead and loses 45 pounds, 20% of his body weight. And his comment to me was, Dr. Gerber, I never thought that a diet could be so easy. I lost my weight by eating. And I think that's a wonderful comment. So if you want to do some reading, this is my favorite author, Gary Taubes. And he's a scientific writer, and he basically looked at the history of nutrition, and his conclusion is that this history is a history of bad science. I was also going to suggest for next year that you might want to consider a movie called Fathead by Tom Naughton. And it's kind of the sequel to Super Size Me, but it's not. And you might find that interesting. So, we want to redefine healthy nutrition. This is our very last slide. And what we want to do is rebalance the carbohydrate-heavy food pyramid. We want to make healthy food choices based on the carbohydrate content of food. We want to eat unprocessed, unrefined, whole foods. We want to focus on the glycemic index of the foods that we consume. We can count grams of carbohydrate. We want to eat 3 meals. We want to eat snacks that are low glycemic index snacks. We want to, and what this will do is the quantity and the portion of the food will be controlled by itself. Again, these nutrient-dense foods that are low glycemic foods will help us lose weight. Appetite will be controlled, and these are the tools. These are what we want to call the correct tools to help patients and to improve health for life. Exercise, of course, is important, and as a healthcare professional, we want to really embrace the concept that nutrition is a significant tool to help our patients for life. And so, like Hippocrates has said, good food is good medicine. And if you're interested, if you talk to your parents about this tonight, they can go to my website. I have a lot of information there. And you guys were really good. Thank you so much.
Clap once, clap twice. We are not finished. If you have a question, this is going to be your chance to ask it.
Can I go to the bathroom? It's going to be all over. Joseph?
You're not going right.
Extremely rude.
So, can everybody hear me? Yeah. Okay, so I had a grandpa who's about 330 pounds. He, after Easter, he went on the Atkins diet, and that means he only ate meat and salad, or what you call plenty food. And I also had a comment about the.
What happened to him?
Well, he's losing some weight. He lost about 30 pounds so far. So and then So people said that sugar's in fruit. Yeah, but that's healthy food. I mean, that's natural sugar.
So that's right, that is natural sugar. And you need some of that, but to a certain extent. If you eat too much, again, the story where, tobacco is tobacco healthy for you because it's a natural thing. And the answer is you have to limit even natural sugar. So, you had a question? No question. Come on up to the mic.
Jacob.
I don't think the teacher's like
It's fine. It's fine.
When did you start to study nutrition?
That's a good question. I've been looking at nutrition for the last 20 years. And in the first 10 years, nutrition didn't make any sense to me. And that was because it was not scientifically based. And over the last 10 years, we've looked at insulin metabolism, and that's really what is clarified.
Good job. What's the average weight people have liposuction? Like, if they're like 400 pounds, do they have like?
Okay, well, liposuction is more for your appearance, but I think a better question is when do they need bariatric surgery where they get a stomach stapling? And there's a parameter called body mass index, and so as the body mass index rises, so if BMI is over 35 or 40, then the insurance company will say, okay, you're overweight enough that we're going to pay for this type of surgery.
Thanks for that.
Sure. I knew you had a question.
Turn around, honey. You got to face the speaker.
How is the study of obesity scientifically based?
Good question.
So, for me, it is the science of insulin resistance that makes it scientifically based. And that's in contrast to the past 60 years where it was considered a lifestyle condition only and really a risk factor. And that has created a barrier to us looking at it as a science of disease. Yes?
Have you ever failed on any of your patients?
Have we struggled with some of the patients helping them lose weight? And the answer is yes. Some patients are very challenging. And again, I had stated that everybody's metabolism is different. And some people just tend to store body fat. And you still have to work with them, encourage them, and but it can be a struggle with some. We're not always 100% successful.